what sort of questions should patients consider asking about their treatment plan?
I think it's important that patients understand a few things, and they can be described in multiple ways. Number one is, of course, what is it that is being used, right? So I think that includes a description of what to expect, the practicalities, the names of the medications, their side effect profile, and what to report when you use those medicines. So I think that's very, very important, because if you're empowered with that information, you're going to be better off as you react for symptoms that may come along. I always tell patients, when you have a cancer diagnosis, your self-awareness goes through the roof, because we're going to be paying attention to everything, every skin change, every pain we have. So I think having a bit of that proactive discussion becomes important as they think about, the treatment. So the what. I think the how to and the practicalities are very, very important. That's where the nursing team and the pharmacists help us a lot too. Do you take the medicines at night? Do you take them with meals? Is there something that you shouldn't be mixing? How much time would it take for me to get a refill? It's different to get a medication from a specialty pharmacy versus your down the street Walgreens. So all of those things is important that patients, again, participate in the understanding. And if not them, at least the caregivers that are part of this team. I think it's important that patients ask also some brief descriptions of the biology of the disease. If I have myeloma, what type of myeloma do I have? Does that matter as far as what treatments I'm going to be using? What treatment options may be available to me because of my specific subtype? And we have subsets of myeloma that have options that are not available to others. And also, I think it's important that patients also ask, a sense from the physicians as to where they are. And I'd like to, describe this a little bit more. Sometimes patients ask us specific questions about, am I in a complete response? Am I in a very good partial response? And what is the PFS? Those terms work very well when we talk about clinical trials, but they don't necessarily describe in a great way the situation for an individual patient. And I use a lot more adjectives than I use technical terms when I describe where patients are. So I say, you have an excellent response. You have a very deep response. And then I provide more details if they want. Yes, you're MRD negative at 10 to the -6. But, sometimes I find that it's harder for patients to understand where they are if they completely focus on the, staging system or the response criteria, et cetera. Because, maybe a VGPR or a very good partial response doesn't sound very good, but then you can be in a very good partial response for 15 years and it doesn't matter. You may want to be on an MRD negative status, but you still have a good outcome. And that's why the general description of the status by the physician becomes important.
Mm-hmm. Do you think patients should get a second opinion consult with a specialist?
In general, my answer is going to be yes, and this is not self-serving. I think myeloma has become so complex that trying to integrate at least once, or if not in some infrequent basis, the opinion of a myeloma specialist becomes important. And this is no one's fault. If you're a community oncologist somewhere where myeloma represents only a small fraction of your practice, I can guarantee you cannot stay on top of the literature. I cannot stay up with everything that goes on in myeloma, even though that's what I do 100% of the time. I get an email every week with all the articles, all the publications, and I have to integrate that. And I have to think, okay, does this matter or not? I go to the professional meetings. I see all the abstracts, and I still feel like I'm missing out. How could you do that if that is only a small fraction of your practice? And I'm sure that the same applies for other cancers, breast and colon. Now, you can't move, you cannot, uproot yourself and leave your community and your family. But I think there should be ways by which patients at least have an opinion from someone who has more expertise. Unfortunately, there are many centers across the nation now that have that expertise for the management of myeloma.